Good afternoon, everyone. Today's Tuesday, September 15th, 2020, and we've convened the Board of Health for the New York City Department of Health and Mental Hygiene. It is 11:30 a.m. and I will call this meeting to order. A very warm welcome to everyone. Nice to see you virtually. To begin, I will conduct a roll call. Are the following members present? Please say here when I call your name. Gail Neowith.
Here.
Dr. Joel Foreman.
Here.
Karen Redliner.
I'm here.
Dr. Lynn Richardson.
Here.
Pamela Breyer.
Here.
Dr. Mitchell Katz. Dr. Katz, are you here? Okay. Rosa Gill.
Here.
Dr. Sixto Caro. Is Dr. Caro here?
He is there. I can see him.
Yeah, I saw him too.
Dr. Caro, if you're on mute, please unmute yourself.
Dura.
Okay, let's come back to him. Dr. Susan Klitzman.
Here.
Okay, and Dr. Caro, are you able to unmute yourself?
It looks like he's calling in, Dr. Chesky. Maybe his mic isn't.
Okay, thank you so much. We'll mark him as here and get his formal attendance a bit later in the meeting. Thanks for letting me know, Dr. Foreman. I can't actually see everyone on the screen. But let's go ahead and get started, please. First, let me just say on a personal note, I'm so grateful to be joining you for my first Board of Health meeting. You all don't need me to tell you as members of the Board of Health yourself, but I think this is a historic institution for New York City with a very important role at this historic time for New York City. I consider myself somewhat of a student of public health in our city and have always derived inspiration from the fact that the Board of Health grew out of some of the most challenging public health crises in the 19th century. And I particularly derive inspiration from the fact that it was something that came about specifically to lift up the health of low-income people at a time when we were facing many different outbreaks from typhus to cholera. And the Board of Health was instrumental in making sure that the health of the marginalized was placed at the center of our overall public health strategy. And so I'm hopeful that, that we will carry that charge forward in this momentous time as well. I want to thank each of you for your service on the board and for welcoming me as the chair. I certainly look forward to getting to know all of you a bit better. Before we dive into the two business items for the meeting, I wanted to take just a moment to share about the values, vision, and strategy for the health department, as well as a brief COVID-19 update here at the beginning. So you can see the slide before you on our core values, mission, vision, and strategy for 2020 to 2021. This is something that I've led the department in an accelerated planning process around just over the past month, trying to take what I know already exemplifies our stellar health department, but also doing some careful reflection about values and priorities and concerns that our staff bring to work every day, but that are also illuminated by the moment that we're in. For me, so much of our work stems from our core values, which are listed here: science, equity, and compassion. And the mission and the vision are things that are familiar to you. I'll highlight the vision of being a city where all New Yorkers can realize their full health potential Importantly, regardless of who they are, where they are from, or where they live. This is really central to making that value of equity come to life. And then our strategy revolves around the idea that the health department must meet the moment. We are experiencing multiple intersecting crises, not just the COVID-19 pandemic and the social and economic upheaval related to it, but also racism as a public health crisis that colors so much of our work together. But the key part of the strategy that I want to make sure to convey to Board of Health members is that we must focus on our COVID-19 response and all of those related parts that we're seeing with respect to public health in the pandemic, and ensure that our health department is oriented toward an effective COVID response to enable the rest of our important work. A little bit more about our COVID-19 priorities. We divide these into 3 categories here. First, no surprise, to prevent or rapidly address a resurgence in COVID-19 infections. I'll speak a little bit more about this on the next slide. Second, to plan and prepare to vaccinate New Yorkers for influenza this fall, as well as COVID-19 when a vaccine is eventually available. Doing this in a way that partners with communities. And then finally, to address what we are starting to call the parallel pandemics related to COVID-19, other infections and chronic diseases, but also recognizing that so many people are experiencing stress and trauma related to this moment that we're in, which affects mental health, as well as overdose. And then the social and economic instability and racism as underlying dynamics that we must also grapple with during this time. Next slide, please. Okay, and so I just wanted to say one more word about where we stand with COVID-19 before we dive into this item. First, we remain in a reasonably sound place when it comes to COVID-19 transmission in our city. We follow 3 public health milestones, the indicators that we report out on daily. That's our percent positivity for COVID-19 testing, which remains around 1%. Our daily reported cases, which has been between about 200 and 250 over the last several days. And then the daily number of people admitted to New York City hospitals for a COVID-like illness, which has been anywhere from about 50 to 80 over the last several days as well. These are sound, as I mentioned, but we're entering into a phase where we're going to do more and more reopening for the city. And so we'll have to watch those indicators, even as we know that risk and exposure may increase with that reopening. One final word just with respect to the big picture, which is how important it is to recognize that we're embarking upon a great set of challenges with school reopening happening right now, with students returning for classes on September 21st. I'll just share on a personal note that I went to visit an elementary school in Brooklyn last Friday to see for myself, how the preparations are going. And met with such dedicated staff, principals, teachers, people who are absorbing a lot with respect to planning, with respect to some of the anxiety that parents and school staff are feeling, and trying to do it all in a way that keeps the mission at the center, which is the importance of reopening schools for children. As a doctor, I think about this with respect to how important it is for the health of children, for social and emotional development, as you know, for their learning, but also because there are so many social services and meals and healthcare that is linked to our schools. And so we have a multiplicity of reasons to focus on school reopening as a key priority in the coming days. Our approach to it has been one where we think about layers of safety, everything from PPE for school staff, ensuring appropriate distancing and mask wearing and hand washing, all of those basics that we know make a big difference with respect to interrupting spread, and then making sure that our test and trace efforts are also linked in to what's happening in our school communities. So let me leave it there with respect to my opening frame. I wanted to start there so that we have the big picture as we go into our business items. So before we discuss the items on today's agenda, I wanted to start with approval of the minutes from the July 7th, 2020 meeting, which you should all have with you. Are there any corrections to the minutes from the July 7th meeting?
Shockingly, no, I have
No.
not.
Thank you as always for reviewing them. If there are no corrections to the minutes from the July 7th meeting, may I have a motion to approve the minutes as distributed?
So moved.
And a second.
So moved.
Thank you. All those in favor?
Aye. Aye.
I,
Second.
Aye.
Any opposed?
Aye.
Any opposed? Okay, thank you. The minutes from the July 7th, 2020 meeting are approved as distributed. Let's move to the two items on our agenda, please. First, today the board will be voting on temporary suspension of childcare staff requirements during this public health emergency. I'll turn it over to Deputy Commissioner Corinne Schiff to present.
Thank you, Commissioner. And good morning, everybody. I'm Corinne Schiff, the Deputy Commissioner for the Division of Environmental Health. And I'm here this morning with Simone Hawkins, who's our Assistant Commissioner for the Bureau of Child Care.
Good morning.
First, I wanted to provide a brief update on childcare during the ongoing public health emergency. So city-regulated childcare programs have been reopening since July when the board lifted the mandatory closure order. We have seen existing programs are adding rooms, and new programs will be opening throughout the fall to accommodate the required smaller group size and to provide care for children on their remote learning days. We are anticipating that programs will need to add staff throughout the fall. And so we're here today to propose two temporary modifications to health code staffing requirements to enable this expansion. I want to provide some background on Article 47 staffing mandates. So the health code sets qualification requirements for staff in order to promote high quality and safe environments for young children. The requirements include educational background, so for example, degree in early childhood education or a related field, and classroom experience. And the requirements depend on the role, of course. There are education directors, group teachers, assistant teachers. The code also allows staff to be qualified for some roles if the person is on a study plan toward achieving a relevant degree. And it sets requirements for coverage of roles by other staff during absences. So the first proposal to the board is to modify study plan requirements for group teachers. The group teachers have three paths to qualification. The person can have a baccalaureate degree in early childhood education or a related field and New York State certification, or have that educational background and experience in early childhood education, or be on a study plan toward a degree. The study plan in turn has certain requirements. The person has to have completed an associate's degree in early childhood education or have classroom experience with either a significant number of college credits or a degree in another field, and be studying toward a degree in a relevant field with a plan to complete that education within 7 years, and needs to provide proof of current enrollment to the department. We're anticipating that as programs expand or open throughout the fall, some prospective group teachers may not be able to be currently enrolled in a degree program, for example, if they hadn't enrolled at the start of this semester. So we're proposing to allow attestation from the staff person of the intent to enroll by fall 2021, and would require that to be approved by the education director. Next, we are proposing that the board modify coverage requirements for the education director. So the education director is really the lead at the child care program, responsible for the educational program and for supervising and training staff. The educational director must be on site whenever the program is operating and cannot have teaching duties for larger programs or if they are serving as the education director for co-located programs. If the education director is absent, the health code requires the program to designate a group teacher to serve as the acting education director. The group teacher who can be designated must have New York State certification. So the group teacher who meets those other options for qualification that we just reviewed, a degree in experience or being on a study plan, can't serve as the acting education director. We are anticipating that education directors and group teachers may be absent more frequently and for longer periods this year. And that could be because they themselves are ill, they may be taking care of ill people, or they may be subject to quarantine. And so we're proposing to temporarily expand eligibility to allow all group teachers to serve as the acting education director, not only a group teacher with state certification. And if it's a group teacher who's on a study plan, we would require that that person be 2 years into that plan. So to summarize the proposals, first would be to temporarily suspend the requirement that a group teacher on a study plan be currently enrolled, so long as the person attests that they intend to enroll by fall 2021 and has approval from the education director, and to temporarily expand eligibility to cover for the education director to all qualified group teachers, so long as the teacher on a study plan has progressed at least 2 years. These proposals would be effective immediately should the board approve, and would remain in effect through the school year, including through the summer school 2021, or could be ended at an earlier date if the health commissioner determines that the order no longer serves the public health. And Assistant Commissioner Hawkins and I would be happy to take questions.
Thank you very much, Deputy Commissioner Schiff. At this time, we'll take questions from the board. You can raise your hand using the function in Zoom, or if you prefer, of course, just raise your hand on the screen, and I'll ask Diana to please help me in identifying any questions. Dr. Richardson has a question.
Yes, thank you for your presentation, Dr. Schiff. Could you tell us the relative size of the 3 groups of teachers that work in daycare? How many are New York State certified? How many have a bachelor's degree but are not certified? And how many have only an associate's degree and are on a study plan? Do you have any sense of the proportions of those?
Hi, so I can provide the amount and particularly the percentage of the total amount of currently registered, and I'm saying registered as based on our system, group teachers that are on the study plan. I would have to get back to you about the other 2 groups. But as of now, we have about 18%, so 1,800 group teachers who are currently identified as being on a study plan.
Okay, so can you, just as a follow-up, so can you tell me if you considered relaxing the requirements for education director to only those teachers who had a bachelor's degree, whether or not they were certified, as opposed to allowing any teacher, even one with an associate degree and who's still on a study plan, to serve as education director? I wonder if some less extensive liberalization of the regulations wouldn't be adequate to serve the purpose of the requested changes.
So we did think through a variety of options. We think the programs are really going to need a lot of flexibility this year. What we might do, and thinking through your question, maybe we should do this, is when we put out guidance if the board adopts this change, the recommendation could be, choices about when you're deciding who should cover, and a preference order. But we do think that programs will need all of the flexibility that they can get in order to remain open. The other, the option for them, that because they do require an education director on site, and we think it's
Right.
critically important that there be a person who is designated as in charge,
Right.
that we don't want them to have to close if the qualified people, if there is someone available to cover. But I think, to your point, we could put out guidance to help programs think through how to select who should cover.
And is there any limit on how long someone could serve as acting director of education?
So the code sets out that if someone will be covering for at least 5 days, they need to notify us of that change. We are expecting here, because the quarantine period is 14 days. It could be that an education director will be out for 14 days, and so we will be working with programs to help them adjust to this time when they will need some added flexibility. And so I think we'll deal with that on a case-by-case basis. Simone, I don't know if you have anything to add about how this will work in practice.
No, I think you captured it right, Corinne. I think we want to kind of eliminate as many barriers as possible to really support families, as we reopen, as Dr. Chakshi mentioned, and they transition back to work.
Thank you.
Dr. Klitzman has a question, and then Dr. Foreman after that.
Thank you. Thank you for the presentation. And I just want to say that both as a parent and as an educator, I truly appreciate the challenge and all that the city and the department are doing to make a healthy and safe educational environment available for our youngest students. In my opinion, those that, most need the in-person education. My question is about the new provision that a teacher provide an attestation of their intent to enroll by fall 21. As a faculty member and administrator at CUNY, which trains, probably the largest group of New York City teachers, I know that a lot can happen between now and then. And I'm sure you've thought through the challenges of different approaches, but intent seems like a pretty low bar. Would you consider other options, having applied, having been accepted, giving people until the spring semester? Many programs admit someone in January. So I was wondering if you could speak to that, because intent seems, again, like a very mushy, low bar to achieve. Thank you.
Sure. Yes. Thank you for the question. And we did consider that and understand that intent provides quite a lot of flexibility. The person on the study plan does need to meet these other requirements. And so what we're really looking for is a person who has some background or experience in early childhood. And we set the intent to enroll by fall because we know that people, everyone is dealing with a lot of different things in their own lives, including their own childcare situation. And so we're just really trying to be flexible while recognizing the need for childcare programs to be able to staff up as they increase the classrooms, the number of classrooms, and as the city adds programs this fall. So we're just recognizing the variability in both the childcare system and in people's personal situations, while trying to make sure that we have people who will be working with young children who have some educational experience and background in early childhood, and that this is their chosen field.
Did you consider other options? I'm wondering, again, maybe having to enroll by January or having to show proof that you've at least applied or been accepted to a program?
Sorry, Simone, were you about to?
Yes.
Were you-
So currently we do require proof of enrollment, and that's one of the things we are asking the board to consider currently and temporarily waiving. Full transparency, we've heard from individuals and providers really sharing concern around their ability to enroll by the spring, and therefore provide proof that they are enrolled or can enroll. Some of that is financial, some of it is related to what Corinne shared about personal issues. So again, here is another attempt at really creating as much flexibility as possible to ensure coverage in child programs.
And I would just add, because I think this is an important question, you know, with respect to the different options, but the uncertainty of the next few months is really what, you know, what pushed us to consider the fall of 2021 as the appropriate timeframe. Dr. Klitzman, if you're okay for me to move on,
Well, yeah, I would just ask then that, you know, we could get a report back at a future board meeting about how this is going and how many people needed to avail themselves of this alternative provision, just so we can have a sense and monitor how it's going. Thank you.
Sure.
That's very reasonable. Dr. Foreman, to you next.
Thank you. I guess first say I support the flexibility. I think there's so much uncertainty right now going forward.
How do I get?
A 1 year period of increased flexibility seems quite reasonable to me. The point I wanted to raise, or the question, is about the education director. And I wanted to ask if the department is going to require or request that the providers have a plan in place and prepare that now with sort of a hierarchy of who would take over as education director, and to ensure that those individuals are familiar with the resources and procedures that they would have to utilize should there be an issue at their center. Just having watched other administrative transitions that might have to happen rapidly if someone is then out on quarantine, having people prepared to know this is your next in line, your second, your third. Here's where this book is, here's the person you call, here's where the equipment is that you might need if there was this sort of an issue. That sort of preparedness in advance, I think, could go a long way.
So one of the things we require at the onset and outside of this particular process is that programs identify persons and designees in place of every required position in their program and reflect that in their programmatic plan and safety plan. So yes. And then one of the other reasons for the notification to the department, so our staff can walk staff through some of those things, right? Have them become familiar with the other person in the program, to the extent, may they need to know subs, how to contact a substitute teacher and so forth, where student files are and how to access them, and who to contact at the department. So absolutely, we do that now, but we absolutely intend to do more of that. Technical assistance, we move through what an accelerated process.
Thank you. Yeah, I guess my point is that it seems that it would be important to update that safety plan now, because you're talking about people who now would be in line to take over as the education director who previously were not eligible and might not be familiar with those issues.
Thank you.
Whenever we bring a proposal to the board, if the board adopts that, we do outreach to all of the programs to let them know about the change. And I think it's an important point, and we can include not only the option for expanded coverage, but also making a plan and training people in advance. And part of our preparation with childcare programs, as we have been training them on all of the COVID mitigation strategies and requirements, has been to prepare for things that may happen with additional people being out. So it's certainly something that we can do as we educate programs about this option if the board approves it.
Great, thank you so much.
Thank you, Dr. Foreman. I don't see any other hands raised. Let me just do a quick
Actually, I have my hand raised, but not electronically. This is Karen Redlener.
Please go ahead, Karen.
Thank you. No, I do appreciate the complexity of the moment and your efforts to prepare for it. So thank you for that. My question is around communication to the families. And just wondering if, as part of this protocol, where there's an expectation that there will be interim directors for various reasons, that there also be in the protocol, which you may already have in place, a communication to the families, or even letting them know ahead of time that this is likely, but we have a plan, and here's the, here are the people that are in place to take on the responsibility of director. And so this is the person you go to if there's a question or a problem, for them to, not be concerned if the education director is out and not be sure about who is responsible.
That's a great point. Sorry.
No, go ahead.
That's a great point. And I think this is really a moment to acknowledge that, when providers go beyond the health code. So no, we do not mandate that they do that, but it is often a part of their just routine practice to keep families up to date and inform them about any changes, especially in program leadership. But we can also add that as part of our communication when we send out just the notification about this in the case it is voted and approved, and the other recommendations we received today.
That's great. Thank you.
I do want to add that when we met in July, when we met in July, one of the items that we had told the board that we would be doing is developing guidance for parents, so they know what to expect in childcare this year and what's expected of them as part of the COVID risk reduction measures. And so we do have an FAQ up on our website. We've sent it to childcare programs, asking them to share it with their families, and we sent it out to families who had registered with us as part of our Childcare Connect website. And so I think this is also something we could, and in many places, because childcare programs are making up their own programs, we said, here's something they need to do. Ask your program how they're going to be implementing that. And so this might be, this is something I think we could add to that FAQ as well, to say, how is your program going to handle what may be more absences than usual?
Yeah, great.
Excellent question. I know Pam has a question as well. Over to you.
Wait.
Pam, if you're speaking, you may be on mute.
Pam, you are on mute.
Hello. Phooey. Never mind.
There you go. Now we can hear you.
Hello.
We can hear you now.
Indira. Oh, great. All right. So I want to underscore this point about, and I want to ask again, this is going to be in effect through when? I just want to be reminded. Through the 2021 school year.
Yes, the school year plus the summer
Go
session.
ahead.
So through August 2021, unless the commissioner determines that it's not necessary, it could end it earlier.
So my suggestion would be through this, while the board gets to be every other meeting or something about what of this, that we encourage the department or the childcare centers themselves to data and see what we want to do going forward. And we just don't know what's going to happen, but there's just reflecting on what's gone on in terms of the communication around the public schools. I feel like you can't do enough communication with people, and that it reassures people, and for so many reasons is the right thing to do. So that's the only thing I would like to underscore, really. This is not forever, so I can't imagine there will be a lot of long-term bad sequelae from.
We have done a lot of outreach and education for the childcare industry, including we did a series of webinars. I think we had 10 or 11 quote sold out sessions. Of course, it was free of charge, but they were booked, and that webinar is available on our website. We've done multiple. We email out to all of the providers regularly, and we've developed FAQs and other guidance documents for them. So we would do the same here, develop a guidance document and send that out to all of the programs. And the Bureau of Child Care is also providing one-on-one technical assistance for programs that have questions and need support. So appreciate the question, and we agree that outreach and a lot of communication is really helpful for everybody as we all navigate through this.
Thank you very much for those questions. I'm doing one last check. I don't see any hands raised. Anyone with remaining questions? Okay, hearing none, let me just check with Deputy Commissioner Schiff. My listening to this rich discussion is that there are some adjustments and refinements to the guidance that will accompany this change, but did you hear anything that would require a change to the order itself?
I didn't. Thank you for all of these recommendations. We will build that into the guidance documents that we will develop and send out quickly to childcare programs, and we'll also monitor and report back to the board on what we're finding.
Okay, thank you. So then may I have a motion to continue with the order as presented?
So moved. Aaron?
Thank you. May I have a second?
Second.
And who was the second?
I was.
Was it Pam?
We'll give it to Pam. Wonderful. I'll take a vote from each member now. So starting with Gail Naowith.
Well, Commissioner, I want to explain that I'm going to be recusing myself from voting on these orders because I'm working with the city to develop the new emergency child care program called Learning.
That's right. And thank you so much for that, that fundamentally important work. And abstention is recorded. Dr. Joel Foreman.
In favor.
Wonderful. Confirming that Karen Redlener is an aye due to her second. Dr.
Yes.
Lynn Richardson.
I vote aye.
And Pam is also an aye. Dr. Mitch Katz.
Yes, aye.
Rosa Gill.
Yes.
Thank you. Dr. Sixto Caro.
Yes. Yes.
Thank you. And Dr. Susan Klitzman.
Aye.
Okay, with a unanimous vote, with the exception of one abstention from Gail Naowith, the motion carries. Thank you again. Next, the board will be voting on temporary suspension of school medical room requirements. And our presenter is Gail Admin, Director of Nursing Services from the Office of School Health. I'll turn the presentation over to Gail. Thank you.
Thank you, Commissioner Shachi.
Good afternoon and good afternoon to the board. I'm Gail Admin. I'm the Director of Nursing with the Office of School Health, and with me today is our Assistant Commissioner, Dr. Roger Platt. Next slide. Next slide, please. So New York City Emergency Executive Order number 98. Emergency Executive Order directed all agency heads, including the Department of Health and the Department of Health and Mental Hygiene and the Board of Education and the Board of Health, to take all appropriate and necessary steps to preserve public safety and to render all required and available assistance to protect the security, well-being, and the health of the residents of the city. Next slide. School nurses and medical rooms. On August 13, 2020, Mayor Bill de Blasio and the New York City Schools Chancellor, Richard Carranza, announced the city's intention to provide a school nurse in every public school building and early childhood programs across the city. Health Code 4907 was adopted last year to require that schools where a Department of Health or a Department of Education nurse provides health services to have a medical room in a dedicated wheelchair accessible space with no through traffic on a lower floor and in a central location, and mandate certain specific requirements for the room's equipment and features. Not all schools have been able to meet these standards and are therefore not eligible to have a DOHMH nurse or a DOE nurse stationed in them. Next slide. Health Code 4907 includes that the school medical room should have a dedicated workstation, a medicine cabinet,
First one.
appropriate waiting area, and a bathroom internal to the medical room, and other items, other standards. Next slide. Having a nurse stationed in every school building where on-site learning is held would serve the public health and may help stop the spread of COVID-19 in the city. But some school buildings may not be able to meet
Which one is it? Okay.
may not be able to meet all requirements, maintain medical rooms in accordance with the
Can you
subdivision
mute
of Section 4907. In order to place a DOE or DOHMH nurse in these locations, as needed, the requirements of the Health Code 4907 must be relaxed. We propose the suspension of the medical room standards. We're requesting that the board suspend all medical room requirements with the exception of requirements pertaining to the availability of a sink with hot and cold running water and a telephone line able to make direct calls outside of the school building, for example, 911 calls. A school whose building is unable to accommodate the requirements may notify the department, and the department may modify the requirements, including imposing additional precautions for an individual school or building to the minimum extent necessary to provide a nurse at the school. The suspension will be in effect for the 2020-2021 school year, including any summer session in 2021. The commissioner has the authority to reinstate the requirements of 4907 if it is determined that this order of suspension no longer serves the public health. Thank you. Any questions?
Thank you, Gail. And at this time, we'll open it up for questions once again. Please raise your hand virtually or on screen. Dr. Klitzman.
Thank you for your presentation. I just was wondering, before we get started with questions, if you could give us a sense of the magnitude of this issue, both in terms of how many schools do not have and would, are needing to get a school nurse, and also how many schools do not meet the requirements for the medical room and would be affected by this proposal.
So I'll turn it over to Dr. Platt to respond to that question. You're on mute, Dr.
Mute,
Platt.
Roger.
We unfortunately don't really know the answer to that question. The mayor's order would result in a nurse being placed in 200 sites, roughly 200 sites that we've never served before. So we have not had a chance to survey those sites. I do believe there will be a substantial number that don't meet the requirement, but I can't give you a precise number.
And just a follow-up question, is the department planning to inspect those sites, or what's your approach going to be in those sites?
We will inspect those sites. We will also obviously be getting feedback from nurses when they tell us individually exactly what the conditions under which they will be working.
Dr. Richardson.
Thank you, Dr. Chakshi. So obviously the intent to make it possible to place a nurse in every school during the current school year is serves an important public health purpose. I just wonder if there was some other vehicle available to the department rather than a suspension, because as I understand it, suspension would suspend the rules for all schools, including those that currently meet the standards. And my concern is, having had a little bit of direct experience with spaces being moved around and new spaces being used for different purposes, and as we try to respond to this pandemic, that we might lose some current properly equipped medical rooms because someone decides there's some higher purpose served for that space. Would it not be possible to waive the requirements for schools that are unable to meet them rather than suspending the requirements completely? And I guess this is really a question for the department's legal team, but I agree with the intent, but I think we should try to take the sort of the most conservative action possible to achieve that intent. And I worry that suspension is not the best choice.
Well, so thank you. So I think that from a legal perspective, we could certainly, if this would make sense programmatically, I think we could modify the order to say that it suspends it for the schools that are not able to comply with the medical room requirements. If that's something that we think is appropriate. I guess my understanding was that it seemed like it seemed to be more of a problem across the board, but I would defer to the program in terms of what more information they might have.
Thank you. I appreciate that. I think amending the order so that it only suspended the requirements for schools that are not currently in compliance would address my concern, as opposed to broadly suspending it, and then we might actually move backwards.
I have
Dr. Platt, go ahead.
No programmatic objection to that suggestion.
I don't have any objections either.
Thank you both.
Do that.
Thank you for raising that important point. I don't see any other hands raised. Please let me know if there are other questions.
So I think that if we are going to change this order, I think we do need to make sure that everyone, I think, is comfortable with the wording of the order. So would we want it to say that the Board of Health hereby suspends subdivision D, of the health code to the extent schools cannot comply with the medical room requirements. Would that be okay for the board?
Well,
That
I guess
sounds reasonable from my perspective. Let's see what others think.
I guess I want something that's easy to enforce, because cannot comply is, an assertion that a school could make, even a school that's currently compliant. I mean, I would be more comfortable with the wording that it's suspended for any facility that does not currently have a medical room that is compliant with the standards.
As of the date of the order.
As of the date of the order, right. I think that's easy, because now there will, where the nurses are now. All of the schools that have compliant medical rooms, I assume, have nurses, or at least all the places where nurses are now are compliant. Is that correct?
Correct.
Certainly no.
Right. So those would not change. Those could not change. They could not give that room up to some other purpose because of the suspension. They would be committed to continuing to use that room. For those that at the moment you don't know, they would be able to get a nurse even if they can't comply. So I feel like it really contains where the rules would be suspended. I don't know if that's good.
I think that would probably work, but we would continue. I just want to make sure we would continue the exception for the other schools that are not able to comply, so that they would still need,
They'd still be able to get a nurse, yes.
Yeah.
Again, I think the overriding public purpose of having a nurse in every school,
That's
we really
right.
have to make sure that is achieved. But we would like the nurses, if at all possible, to have a properly equipped room, and I don't want to lose ground.
Okay, understood. Thank you. Thank you.
Thank you. So Roz, could you please summarize for us again what the revision to the language might look like?
So it would, in substance, it would look like, now therefore be it resolved that the Board of Health hereby suspends subdivision D of sections 49707 of the Health Code for any, well, we'll play around with the word, but for any school that is not compliant as of the date of this order. There may be a little bit of wordsmithing, but that would be the essence of what the change would be. But then the rest of it would remain, except that the provisions of that would stay intact.
I think that matches the spirit of the discussion, but again, let me just open it up one more time.
I agree.
I think that satisfies my point, and I would, yeah.
Okay, thank you.
Thank you.
Okay, so with no further discussion, may I have a motion to continue with the order as amended?
So moved.
Who was the first so moved, just so we can get your name?
I think I was first. This is Lynn Richardson.
Thank you, Lynn.
And Susan Klitzman will be the second.
Thank you, Susan. And I'll now take a vote from each member, starting with Gail Neowith.
Again, I'm going to abstain and recuse myself.
I understand, thank you. Dr. Joel Foreman.
Aye. Karen
Redliner.
Aye.
Confirming that Dr. Richardson is an aye. Pamela Breyer.
Time to come off mute, Pam.
While Pam works on getting off of mute, I know Dr. Katz had to leave for another meeting. So on to Rosa Gill. Rosa, I think you're on mute.
Yes.
Okay, thank you. And Dr. Sixto Caro.
Aye.
All right.
Aye.
And thank you so much. And Dr. Klitzman was an aye as well, confirming. Coming back to Pam.
Are you there? Are we there? Oh, good. Aye.
Okay. Thank you, Pam. We heard you. All right. So with a vote of 7
Aye.
out of 9 in favor of the motion, with 1 abstention from Gail Naowith, and we'll mark as an abstention for Dr. Katz as well. The motion carries. And let me just say thank you to Dr. Richardson in particular for raising that amendment. It's an important one. I think it reflects what seems like an important function of the board to make sure that we've mitigated any unintended consequences. So, so I appreciate you raising that in particular.
You're very welcome.
All right, let me do one last check with Roz or anyone else on my team before I adjourn the meeting. Any final comments or items that we need to entertain?
No, not from mine.
Okay, well, thank you. I want to thank each and every one of you for everything that I know you're doing, both as members of the Board of Health, but also in your capacity as leaders and as New Yorkers for the COVID-19 response. We've been through such tough months together, I know, over the last several, but this is a series of marathons, as we've started to refer to it in the health department. And so we look forward to continuing to work with all of you together over the next few months as we navigate this as well. Thank you, and I look forward to our next meeting.
Thank you.
Thank you.
Thank you.
Thank you very much.
Bye, everyone.